This episode is proudly brought to you by Optimum Financial Services Group. Optimum has the expertise to guide you through investment, tax, retirement, and estate planning, with a tailored solution to your individual needs. Our objective is to provide you with an optimum solution to protect your wealth. Optimum has expertise in medical aid, legal services, asset finance, and short-term insurance, as well as specialized services in commercial, marine, aviation, and personal liability. Don't choose the average, choose Optimum. Optimum Financial Services Group is an authorized financial services provider. Well, a very good afternoon to you today. Thank you for joining. I'm very excited about today's guest. This is a conversation I've been wanting to have for a very long time. Dr. Anchen Laubscher is the Group Medical Director for Netcare. Now, that's a very senior role as it relates to all things medicine. The buck stops with her, and you can imagine that in this day and age that we've gone through this COVID pandemic, a lot of planning and preparation, of course, for something completely new that no one had ever seen before, and a lot of effort was required to build a high-performance team to tackle that. And just how she did that and the backstory of how she got there, we're going to dive into now. So please enjoy, please take part, ask your questions. My name's Alex McPhail. This is High Performance Teams. Anchen, good day, welcome, and thank you so much for your time joining us today.
Thank you, Alex. Thank you, and happy to be on your show. And thank you very much for inviting me to talk to you today.
This is good, and the privilege and the pleasure is all mine. So thank you for that. I want to just let's just start at what I call the beginning, and we look at the formative years of why people end up where they are in these high-performing teams. So you're a doctor, but you're also a graduate with an MBA, cum laude nogal. And I want to just understand what, if you look back to youthful times as a teen and thinking about where you want to end up, what made you go into medicine? Was there someone in your family, or what was the draw card for you there? And why a flying doctor particularly?
So actually, no, there was no one in my family. I come out of a family of economists and business graduates. So when we went to open days at the university, I think my mum and dad tried to channel us towards the business side of the faculties. But myself and my older brother and younger sister, all three of us decided to study medicine and ended up doing vastly different specialties. So I think I very early on in my high school career, I thought that medicine was definitely one of the things I would consider. In actual fact, I wanted to become Minister of Health, and I decided that studying medicine was a great way to get onto that career path. And through the 6 years of study, I really was very involved in all sorts of leadership initiatives, also very versatile activities, but I really fell in love with clinical medicine. And after my training completion in my years of working in the government facilities as intern and community service doctor, I really fell in love with emergency medicine. And that's how I ended up doing a qualification in emergency medicine towards the end of my community service. And I got a few offers or a few opportunities that I had to decide between. And the Netcare 911 one came across my desk and was definitely the most enticing and the most exciting one. And that's how my career in aviation medicine started off in 2007.
Okay, cool. All right. Well, I'm glad that's a nice summary and a good place for us to then build on this conversation. So I agree. If you anything to do with flying is great. But I'm a bit of a layman with this. Emergency medicine. What does that encompass? In my mind, most things. The reason you're going to hospital is an emergency. So what makes something an emergency medicine?
So emergency medicine really is around the ER, or the emergency room, or the casualty as it's sometimes called. So it's people coming into the hospital context with emergencies. And in the true context where people utilize care or consume care by, for example, general practitioners outside of the emergency context, these are real emergencies, priority 1 and priority 2 type of patients. The pre-hospital emergency context is even more interesting. So some emergency physicians work alongside paramedics and emergency trained nurses on everything that happens outside of the hospital. So wherever someone encounters an emergency, phones an ambulance, and that is when this team gets activated. And that's really then the type of work that I did for Netcare 911, is everything that happens outside of the hospital until you drop the patient off and hand over the patient to your colleagues inside the emergency room, inside the hospital.
Okay, so just for absolute clarity, so would both your team inside and the team before it gets to the hospital do the same training, or does it also specialize and split out before you get there in terms
No,
of
they
like being
do.
ambulance or emergency room staff?
Yeah, so we do the same type of emergency training as medical doctors.
Yeah.
The in-hospital teams also further specialize in in-hospital emergency
Okay.
medicine, and there's a separate qualification for pre-hospital. And the
Okay.
paramedics predominantly function outside of the hospital.
Okay, cool. All right. So now clarify that. All right. So and tell me, helicopters and flying around, that must have been fun. So you've obviously done the medical side training, but you applied for this job at Netcare 911, knowing that it's a flying job right away. You weren't applying for a job with Netcare. It was Netcare 911 on the helicopter or the ambulance.
Yeah, exactly. So it was the aeromedical division or the emergency division of Netcare is called Netcare 911, and it's road ambulances as well as response cars, as well as helicopters and fixed wing aircraft, doing all sorts of different types of transport medicine. So in fact, in my interview, when I was interviewed by the medical director of 911, there was a call that came in about a helicopter activation. I saw everybody get up and get onto the helicopter in 2 to 3 minutes, and I thought this is a very cool place to be. I want to learn how to do this, and that's how I got into it.
Well, I think a lot of people would agree with that. Even if you just stand around and see that, like the title card, that photo, that 222 helicopter there, just people arriving in uniform with like reflective gear, getting into a helicopter, you know that something's about to happen. And don't we all want to be part of something great, about helping somebody and something so exciting and fast paced and coordinated teamwork?
Yeah, no, absolutely, and it's really actually being at the front line of care. Rolling up your sleeves and literally getting your hands dirty with things that you can see makes an actual difference. So it's not managing something chronically, which you have to observe through series of blood tests or radiological examinations. You really just see the effect of what you do, and you do absolutely work in a team. Sometimes small teams, especially when you are on the road in a response car, you are often the first person to arrive on a scene before some of your colleagues arrive. So it can be quite intimidating, being the first one to arrive on the scene. But most of the time, it's about how you function as a team, how you communicate, how you leverage the strengths and the qualifications and the skills of your teammates to actually conduct the situation to the best outcome that you could possibly achieve.
Okay, great. I'm going to pick up more on that later. But before we go further, I just want to bring out I've spoken with a few other people in this kind of environment. We have Kevin, a friend of mine, who flew the Red Cross AMS helicopter, and he was always very inquisitive as to what's going on and integral to obviously the team. But he's a pilot, not the doctor. And Buta Dipana, he also gave his experiences flying the helicopter around. But now we've got the doctor on the scene. Now you come out of studying your the training as a doctor, and then the further training in emergency medicine, and then you get on obviously the in-house training through Netcare 911. What is your perception of the team as it relates to, well, there's a pilot that operates this mobile ambulance, and you, the specialist, with the patient once you land, and the interplay between making sure we get there quickly, safely, and then you take over and you do the quickly, efficiently look after the patient, and then you hand back to the pilot or the aircrew to quickly, safely get back to the hospital again. What is your experience from your side of the helicopter, as it were, or the whatever equipment you were using at the time, and how it relates to your role switching on and off?
So I think for the entire team involved, and when it's a helicopter or a fixed wing aircraft team, it's this very small, close knit group of people. I think it all starts with very meticulous preparation. I think you as a pilot know that there's certain things, starting off with your qualification, maintaining your skills and your credibility and your competence is basically the basic layer of your preparation. And then when you arrive on your shift, there's a very detailed preparation schedule that you have to go through, checking all your equipment, checking your medication, making sure you've got everything, you know exactly where it is. And then when you get the call to make a decision, it's also again a team effort. So there's always the pilots and on the one side and the paramedics and the doctors on the other side doing their meticulous preparation. And then the call comes in and there's two different levels of decision making. So the medical team decides whether this call is medically justified or something that you need to go out to. What would you need? What do you need to take with you? And you start thinking about how you're going to manage the situation. And on the other side, the pilots have to think about, can we fly there? How much fuel do we need? What's what's the weather like. So you make completely independent decisions, because you would never want the pilot's decision to be influenced by the medical decision, and vice versa. So both teams decide it's good to go. You get into the aircraft, you take whatever you need. And as you get there, it then becomes your collective responsibility to stay safe. So if you fly a helicopter at night to an unknown location, it's all hands on deck and all eyes looking out for power lines and and to ensure the safety of the crew. Because if anyone in the team then would fail, that the whole team is potentially compromised, and not arriving on the scene is not really going to help the patient. So that then becomes the ultimate outcome. Arriving on the scene then, making the decision about, are you going to shut down the helicopter? Are you going to keep it running hot? How much time do you need? What do you need to do? And then working in synchrony with your clinical colleague with you to execute on your decisions related to care, with the team on the ground, getting back into the helicopter. And then that's also an important part of preparation, because in the helicopter cockpit, it's a really small and a confined space. You can't exactly take out your stethoscope and listen to someone's chest. So you must anticipate what's going to happen in that period and be prepared until you get to the ground and hand over your patient to the team on the ground. And communication is critically important through all of that, because there's critical pieces of information that you have from the scene that's very important to be communicated to your colleague in the hospital, and to put together all the pieces of the puzzle, which is all part of making a diagnosis, intervening, and ensuring effective care.
Okay, well, it sounds thorough and comprehensive, and exactly the kind of conversation that I was hoping for. But one thing you said earlier, which reminds me of my childhood, I was part of the NSRI as a volunteer crew member as a youth. I was 16 in Station 10 in Simonstown. And I remember the individual who used to drive it wasn't an ambulance, but it was a 4x4. He rigged up as a kind of an ambulance, Chops Craig, a famous guy down there. And he would say, one of the early days, listen, we're not rushing. There's no point in us not getting there. That's the primary goal, is that this ambulance has to get to the patient. So I appreciate that you picked up on that point there too. But I also want to ask you now, as it relates to whether you're going to shut down the engine or not, are you going to keep it, is it a hot running or not? Where does that decision lie in terms of who makes that call? Is that something that you would suggest? We need to get him out of here quickly, back to the hospital? Or is it more as it relates to the safety of the vehicle, the helicopter in this instance?
So it's a very interesting thing to talk about, this something called multifactor decision making, and how you contemplate all of the variables and decide what is the best risk-based approach to take. So specifically in trauma, there's something that I'm sure everybody knows we talk about as the golden hour. So that means that you really have got a finite period where your interventions are going to carry the most weight. So what you do not want to do is waste time in that time. Shutting down the helicopter and then starting it up again takes a certain number of minutes. In a golden hour, 6 or 12 minutes makes a huge difference. Then you also need to consider what it is that you have to do for the patient on the scene. So in terms of all of these interventions in preparation, because should you take off and you need to do an emergency landing, once again, time is critically important, and you would potentially compromise safety, and also you would waste some time. So the decision is always, before you land, you'll check with the pilots to say which hospital are we going to and how long is our flying time going to be, because that also impacts your decision making. If your flying time is 6 or 10 or 12 minutes versus 20 to 30 minutes, you make different decisions on the scene. And then you go and you get your handover with your crewmates, and you then make a decision whether you're going to run out or whether you are going to shut down and spend more time on the scene. So it's all about time. And thinking ahead of what it is that you would like to achieve.
Okay, and that's interesting as well, because I could relate to the time aspect. As an airline pilot, you fill up the tanks, you go on a flight. If something goes wrong, time is ticking, because the amount of fuel in the tanks in kilograms is the amount of time you got left to fly. There's no filling stations up there, so you have to make a decision based on time there. So this is in a way more accelerated scale. You're talking in 1 or 2 minutes, not in hours. But now you also mentioned something earlier about the shutdown and the decision making, and then or shutdown or not shutdown. But coming into dark landing in these HEMS environments, all hands on deck, everybody looking out for power lines, etc. So in that instance, you're an air crew and you're giving assistance to the pilot operating the aircraft to land. Is there an instance on the other side of the fence where the pilot is no longer flying because the aircraft's safe, you're busy with the patient? Is there any instance where a pilot would be looking over you and give you input. What kind of input would you receive willingly from a pilot who's not medically trained? I think we lost you.
Yes,
Sorry, I've lost
absolutely.
you. Okay.
It's a very close-knit team. So no, I got you back. So there's absolutely true that you become crew. You also become crew in the fixed wing environment where you're also medical crew, and the pilots fly for very long hours during the night, and you can maybe sit and rest a little bit, and we make sure that they are fed and they get coffee and that we talk to them. So you really look after the pilots as well. So you become like an aerostess in some instances. And you also become the security officer, and vice versa. The pilots often help you. I think two critical pieces where they help you is sometimes you just need a lot of hands and you need people to hold things for you, carry things for you, help you lift heavy equipment, heavy patients, hike up a mountain to go rescue a patient. And then the pilots always, doubled up as our medical counterparts. The other very important thing is about communicating with us, because if things do deteriorate up in the air, what you want is some voice telling you regularly, where are we, how long is it going to be? And you would often ask the pilots if they could fly a little bit faster, if they can step on the petrol a little bit heavier, if you have trouble. So I think those are the two places. So you definitely double up. You become this close-knit 4-member team that plays into each other's spaces, but remains responsible for your area of expertise.
Okay, well, that's great. That's the kind of answer I was hoping there'll be something along those lines, and thanks for that. I also just want to give a bit of a shout out to people joining us live at the moment. We've got Fran joining us on LinkedIn, Kim, hello, Jordan saying hello, that's great, Tasha, how's it, Tasha? Craig Wood, somebody you also know, let's bring him in here. He says that he wants to know, what's the greatest advance in technology you have experienced in this field, and do you see AI, robotics, or unmanned flight threatening or complementing the current medevac situation?
Yeah, Craig, I think nice to see you. I've worked with Craig before as a friend and colleague of mine. So I think one thing that definitely comes to mind is the use of geolocation and AI in that sense, and specifically in the 911 environment. And you also know that, managing your resources in these kinds of environments are expensive, and often you have to be clever about it to ensure its safety. So knowing exactly where certain incidents happen, specifically thinking about the road, allows you to put your ambulances in close proximity to those places at certain given points in time. And Netcare 911 has done amazing work on this to decrease the arrival to scene time. So from the call coming in to deciding to dispatch an ambulance or a helicopter, the time to arrival on scene is a very important parameter or indicator about the final outcome that you are going to achieve. Again, speaking about that golden hour. So the use of navigation information, GPS location information, and putting that into AI models to get us to be positioned at the best place with the right equipment and the right resources helps us to help our patients much better.
Okay, that's great. Well, thanks. I'm sure Craig will be happy with that answer. Anchen, we could probably talk the rest of the show about the air crew and these kind of medevacs and things, but I wanted to use it as a springboard and a base to build into the conversation, because I want to get to the mammoth task faced this year by all medical staff, but also particularly people in leadership positions who had to create something out of this hectic coronavirus situation and prepare and execute on it. But just before we dive into there, I want to just then understand. So you spent this great amount of time when I say, I mean, you had a great time spending time in the helicopter flying doctor situation, and it sounds like a wonderful team environment to cut your teeth and to just soak it all in. High performing, time critical situations is really enjoyable to get right. But then you went on to do some extra studying, post-grad studying, and then on to do an MBA as well. So what made you decide to do some further studies that's not quite medical related, MBA, etc.? You mentioned about becoming the Minister of Health. Is that something that you had your eye on still then, or by then that you already decided that the sort of the business side of things is interesting and I want to go up into sort of the leadership of hospitals, etc.?
Yeah, so Alex, going back to the origin of the wanting to be the Minister of Health, I think it maybe is even just, it's a metaphor for thinking that you would like to influence a bigger system. So, as a doctor, you're generally involved in one-on-one patient care, and you really zone into becoming very, very specialized on single repetitive interventions. And that resonates with most of the people in the medical fraternity. And I specifically had a desire to influence the health system as a whole, and getting involved into understanding why certain policies are formulated, how these could be amended, what information you need to inform a system, on the broader scheme of things, and whether that is as working in phenomenal institutions such as the World Health Organization, or working for the health ministry, for example, in a certain country, or whether it is working in an organization where I have the privilege to be at the moment. We've got 23,000 employees and more in a certain amount of hospital beds and 56 hospitals across the country, and that is your area of influence, and that is where you can work on the system, enabling the clinicians at the front line then to do their best in terms of direct patient care. So that's really where I got to the MBA. And in fact, I wanted to do the MBA straight out of med school. It's just that I then fell in love with clinical medicine so much that I spend some more time there. And the MBA is really, it is around business, but it's also around very important leadership aspects.
Sure.
And what you learn there also to, you also manage dynamic teams. You work in a team environment in terms of getting sort of the assignments done, and the content is really informing you from an economics, policy, business, leadership, and people management point of view, which I found to be a very valuable asset from an education point of view.
Okay, cool. Well, I mean, I know it's in my perception, it's not a common route for a doctor to go on to do an MBA. It certainly is a route, but it's not very common, well-trodden path. But it certainly does result in good things. You've got the great medical background, and you can build that on with business and leadership to then offer that leadership position in a medical situation, such as you find yourself in now. So you've promoted along and done more training along the way. And now, if I understand correctly, as the Group Medical Director for Netcare, the buck stops with you at all things medicine. You report straight to the CEO of Netcare, and as you mentioned, 56 hospitals and 20-something thousand employees. That's quite a senior position, and you're going along steadily. Last year, beginning of this year, coming along, and all of a sudden, something massive arrives on your desk in January, February. Or maybe it was before then, but certainly some big decisions need to happen by February with this coronavirus pandemic. So, firstly, maybe just tell me your thoughts about being in a position, and you've obviously built up the experience as being part of a high-performing team in the Flying Doctors. You've further equipped yourself doing the MBA with academics, and you're in the position. When something like this comes across your desk, what sort of feeling do you have that this is something I can sink my teeth into, or fear of, I don't know if I'm ready for this thing, or is anyone ever ready for it? Just give me a sense of the thoughts around February this year, where you're realizing something big has to happen, and there's no precedent for this before.
Yeah, I think that's something very interesting, and I'm very passionate in exploring, how these things are actually managed. I'm a huge fan of the book and the movie Slumdog Millionaire, and I think it's important just to pause about. I think the most important lesson out of that book for me was how someone gets to a point where you are skilled and equipped to do certain things, and you think, but where did I learn all of this? And then you think about the accumulative events in your life, and the fact that I really believe that no lesson learned is ever wasted, and no education is ever wasted. And I think all of the things that I've done in terms of academic education, as well as random things in the Netcare 911 call center, sometimes in the middle of the night, all accumulated to equip us as a team to be able to manage this. And I think from a disaster management perspective, having done a lot of that type of work across the African continent in 911 and also further in Netcare, also further equipped us. Very, very importantly was the 2014 Ebola virus disease outbreak that really confronted us in Netcare, and being the recipient of many patients out of Africa that present knowingly or unknowingly with this, and building a system that equipped us to manage that risk to the extent that we actually had no Ebola virus disease patient entered the South African context, neither in the private or the public space. So when this risk came on our radar, actually the 31st of December last year, and then throughout January, I think we realized very soon that we were faced with a viral tsunami, an unprecedented viral tsunami. And we activated in our organization a disaster management response, which is really clearly defined by certain phases. So we went into this preparation phase, and learning everything we can about this unknown virus. And and at the beginning of February, the virus was really about 5 weeks old globally. There was an absolute overwhelm of information, news, fake news, academic articles, literature. The very realms of research was shaken to the core by big retractions from prominent journals with data that was significantly influenced. So there was a lot of information to work with. And you had an organization that was responsible for safeguarding healthcare workers and safeguarding patients to get us through the pandemic. And you had to make sense out of all of this information to discern certain protocols that you were decisive about and which you consistently executed to navigate your organization and your team through this. And I think that was really how we managed it. And the rapidness of the learning was something amazing. The pace at which the information became available, and that you had to stay on top of all of that to manage this complexity and to discern a contextually relevant plan for your organization to get yourself through the phases of the pandemic that started with preparedness and then went on to containment and then saw itself go through a surge which happened at different times in different provinces in our country, and then getting yourself where we are now in a recovery phase and then potentially preparing for a second surge.
Okay, before we go into second surges, and you guys are welcome to share your comments. Dr. Augusta Dorning joins us from LinkedIn saying the Netcare response was phenomenal and the Netcare team helped many other teams. Congrats, Anchen and team. So thanks for joining us there, Augusta. But I want to just also get to, okay, so you've given a nice context of the academics and the processes that you went through, but what were you feeling in January and February? Like, how involved were you in 2014 with the creating teams or creating protocols or in the leadership role of what you face yourself in now? Was it a similar kind of experience on a smaller scale, or were you more of an assistant role back then? What were you feeling in December, Jan, Feb, knowing that this is going to land up on your plate?
Yeah, I think in 2014, I was also very much in a leadership position around managing this risk, but the risk was more confined, and it was easier to see. Ebola virus disease is a very different kind of disease than COVID-19, which presents asymptomatically in so many patients. The Ebola risk is I almost want to say it's much easier to manage than the COVID risk. The COVID risk was much more overwhelming. We're faced with a world where people travel at the drop of a hat between countries and between continents, and all of that was still happening in January and February this year. So in January and February this year, we were looking forward to the year that was going to be completely different from the one that we've experienced. We had our strategy, we had our plans, we had our targets that we wanted to achieve for this year, and we were running along, to try to achieve that. And all of that was changed and deprioritized. So there's the beginning period of uncertainty where you're not sure what the impact is going to be, but you have to prepare for the worst. And you have to think about the global impact on the supply chain. What are going to be all the capacity constraints that we may encounter? How are we going to provision for that? What data and models are we going to use to try to predict how pronounced this effect is going to be on your organization, and constantly making these decisions in a stepwise approach as the pandemic unfolds. So I think it was a very similar position, but it was a global impact versus a continent impact, and it was a tsunami compared to a tidal wave.
Yeah, I'm sure. So, I mean, this is probably one of those things, most industries or recognized industries will have these kind of things where you'll get an armchair expert or the public opinion, but I don't think anything has been experienced like COVID-19 where everyone's got their opinion on it. How do you sift through the data? Now, for me to sift through the data is important enough for me to make good sense of what I want to do and how I want to approach it. But not on the scale that, I mean, the way you have to sift through data in your team, it's the same. Well, you have access to more information, but the volume of work is there. How do you decide what we're going to trust and what we're not? Because some information is fresh and new and might be incorrect because it's new, not because it's fake. Still, it's just as damaging if you get it wrong. What process is in place to make sure you have the right information and you're sharing the right information? And how soon do you implement something that you think is a good idea before you wonder if it maybe changes around?
Yeah, and I think that was probably the most difficult thing to manage during this pandemic. So I think what we did is we very early on decided that we have to put certain structures around decision making in place. So the phases of disaster management was a good framework. In such chaos, I personally always feel that creating structure is helpful. You also have to be very agile, even in that structural approach. You have to understand that things can change and that you have to be very agile in your response, but not in a confusing manner. So you have to have the balance between communicating and changing your mind too rapidly versus waiting too long and letting something linger for too long. So I think the structure around the disaster management principles was important. We also looked at what is called the hierarchy of control, from an occupational health and safety point of view, which talks about the things that you do from an engineering and an infrastructural point of view, from a policy point of view, admin, behavioral. So it just guides you through all of the interventions that you have to put in place. And as the variables change, how you have to sort of like incrementally adjust all of your decisions in that regard. I think it was also very, very important to look what the global institutions like the World Health Organization recommended, and at all times be in line with the local Department of Health and the National Institute of Communicable Diseases as the ultimate experts and leaders in this country. So there was a nuanced kind of Netcare response, but at all times compliant to what the DOH and our Minister of Health, which we really exhibited exemplary leadership behavior through this pandemic, guided us what to do. And then there was also literature and protocols, which drugs and which equipment. And I think in South Africa, we benefited from learning from the rest of from other countries. And I think in terms of that period of lockdown where we had time to say, what equipment do we need? Which is the best ventilation equipment? What can we learn from our colleagues in other countries and from the Western Cape? Because the Western Cape colleagues really saw the surge first and did phenomenal work in the hospitals in the Western Cape, both private and public, and learning from them, and then very early on preparing to get all of this equipment and drugs in place. It was a very complex, chaotic environment that you had to rock up every day, show up, make decisions, and execute on them.
But I just want to ask you, before your answers always bring out another 5 questions, so I'm keeping track of my fingers here. But have you had a break since this started?
Did we get a break?
Have you had any time off since you've dived in January? Have you had some time off?
A very small little break. When we saw ourselves through this surge towards the end of September, there was a long weekend in South Africa, and I think all of us worked day and night through Easter weekend and all of the normal public holidays. So I took a small breather there. My family came to visit me for my birthday, and then it was back. Normal business was so. In terms of that's an important thing to say, because in terms of disaster management, the recovery phase is very important. Also to minimize and manage the socioeconomic impact, which is really profound in our country. So then getting back to the normal business things. So it was a small break, and now we're back on track.
Okay, before you run away, I wanted to make sure you had some time. Like a couple of days is better than no days. But going back to your answer of the previous question, it made me think, and we were talking off air about Dr. Atul Gawande, who wrote that great book, The Checklist Manifesto. Highly recommend everyone read The Checklist Manifesto. Even if you're nowhere near inclined to medicine, it's fascinating. And as a pilot, I recommend it to all my students doing crew resource management training, because it's just got such good information to it. But what stands out there for me, and it's how it's applicable to aviation, and it came out with your answer just now, is that similarly, in medicine, there's about 4,000 odd procedures he mentioned. This could be older data now. And in aviation, in a modern airliner, 4,000 odd things can go wrong. Now, there's no way you can remember all those things. So how would you do it? And you have to build these frameworks. You spoke about structures in the beginning of the show. And in aviation, you get these toolkits in order to guide your decision-making and make the best decision. And as you said a moment ago, information is changing often, but you still have to make this decision. Like in the airliner, when the time's ticking and the fuel's burning, that's it. You've got a finite amount of time, and whether you do or you don't make a decision, the fuel will run out in the same amount of time. So rather make a good decision the best you can, and if more information becomes available, then you course correct. And hopefully with that process, you kind of get yourself on the path that you're kind of working towards, and rather than sort of jumping 180 degrees out, because you're still using the information as best you can. But as it relates to a framework of thinking and guided decision-making, practically, did you change anything, or was the systems in place for the last X many years already in a system like Netcare, where guided decision-making was already in place and you would just use the frameworks already available?
So I think there was a lot of frameworks available, but there was also a lot of learnings through this process. And something that I thought of while you were talking now is about how we managed the different zones in the hospital. So we very early on divided our hospitals into red, yellow, and green zones. So red was the confirmed COVID patients, yellow were the ones that were potentially COVID, and green was non-COVID. And you had to think about, hospital is a complex place where normal emergencies continue to happen. So people continue to have babies and surgical and medical emergencies. And so you had to provision in each of these service lines a place for a red and a yellow and a green patient. And then the protection of the other patients and your healthcare workers were critical, because similar to, not arriving to the scene, not enabling you to treat your patient in the helicopter, getting your healthcare workers to contract COVID was similarly crippling. So you had to protect your healthcare workforce. So you had to discern out of a myriad of protocols around what was the appropriate level of PPE to use, what was safe, and you had you couldn't leave it up to the people at the front line who's confronted by the complexity of dealing with sick patients, their own personal fears around their own safety, to make those decisions. So you have to be very clear on what is the right protocol from a PPE perspective to safeguard our healthcare workers and our patients. And that was also impacted by the global supply chain that was significantly impacted. So were we going to have enough PPE, or were we going to see a situation that they had in New York, where healthcare workers essentially had to wrap themselves sometimes in plastic black bags because they didn't have enough gowns? So that's an example of how we had to constantly critically review it, and just ultimate goal was safeguarding patients and safeguarding healthcare workers.
Okay, yeah, no, that's a good answer, and it also makes me think of, in the early days of where we, as an airline, where we were doing these repatriation flights and flights that were to bring in cargo, these PPE, masks, etc. When it was first mentioned that there's going to be a flight going into Wuhan, the whole world thought, oof, or certainly the aircrew that were potentially selected to go on this, or asked to go on this, maybe there was a sense of fear. And what is this place, Wuhan? What is this virus? And then as it went forward, and there was protocols in place that said, this is how you operate and this is how you treat passengers on an airplane. I mean, pilots and cabin crew were wearing these full suits. They were taught how to dispose of it so that you didn't touch anything one-handed. I mean, it was I don't want to use the word over the top, but it was intense. And then are you expected to sit in this kit for 14 hours as you fly from A to B? And I mean, how do you take a rest, and how do you go to the bathroom, and how do you eat it? So all these things. So we experienced that as well, being seemingly frontline operators, moving people around the world. And I'm sure that's an area that really is something, this sort of rapid course correction. And if you look back now on another bit of course correction, the lockdown, we don't have to get into politics, but I think if you did a study of South Africans and you said, was it a good idea taking a 3-week lockdown? I don't think you'll find too many people saying it was a bad idea. When it got extended, I don't think anyone thought that was a bad idea either. But there was a sense of this thing's dragging out now. And what are your thoughts on that in terms of preparation for hospitals? I mean, it was definitely a good idea to get this thing going, but how did it play out for you? Did that bit of breathing time make that much of a difference?
I think it did. I think in terms of, I think there was a lot of good decisions made in that regard. I think it was important to very early on have a universal mask policy. That certainly made a huge difference. And that early lockdown gave health systems the opportunity just to regroup, to breathe, to plan, and to get the necessary things in place, because you had to spend a lot of time, like we said, now working through the information, discerning protocols, procuring the right equipment and consumables. I think that, the sad thing in the South African economy is the significant impact, as it had globally, that it had on our economy. And I think that hard lockdown of 5 weeks was a good thing. In terms of the healthcare system, it also helped us with our burden of trauma. I think the South African healthcare context is unique in its complexity in terms of the burden of disease. So we've got the burden of trauma and interpersonal violence and those things. Then we've got the burden of disease related to chronic illnesses, so the burden of diabetes and hypertension. And then we also have the burden of infectious diseases around TB and HIV. So that triangulation of of those three elements really is a huge burden of disease for healthcare workers and systems to manage in South Africa. And just pausing the lockdown helped just to significantly decrease the burden of trauma and interpersonal violence. That freed up resources from not using consumables for people to be able to treat other patients, and that certainly made a huge difference. So we paid a price for it in terms of our economy, but I think it was the right thing to do where it was. And now I think the important thing in the recovery phase is to say, how are we going to continue to manage normal business as is, and on the sideline potentially continue to manage COVID, which is not going to go away for a number of months ahead of us.
Okay, I want to relate you one more flying story, and I'll try and hold back the flying stories after that. But as aircrew, as pilots on these long flights, we go on a 12-hour mission. We get to work in the evening, and we fly through the night. And at some time, at around 4 or 5 in the morning, certainly in the South African context, we're arriving in Europe. The sun's coming up, and this is about 1 hour before descent to land in somewhere like Germany. It's been a long night. You're tired. You're hot and sweaty and smelly, and you just you're tired. You don't want to be in this environment. But when the sun comes up and you see the Alps in front of you and the Mediterranean, it's a beautiful sight. And that opportunity really just takes you the chance to just look around. And as you see the beauty, up front we've got nice windows. It's bigger windows than you have at the back. You can see 180 degrees around you of this beauty. At the same time, you recognize that you've gone through the night and you've probably done nearly 10,000 kilometers already, and you've just been beetling on at 900 k's an hour. Now it gives you that almost a surge of energy to say, right, the next part is getting very busy. The approach and landing phase is a critical and important phase, and you need to be awake, you need to be ready. And in order to do that, you need to prepare. And we get the setup going for the aircraft, the flight management systems, etc., the briefing. But just that moment where you see the sun coming up and you see the beauty and you realize how far you've come, I want to share that with other industries, with industries that have done well or badly, and particularly in medicine as well. If we look back to February, where this thing kind of started, or January, March, it really started to affect people, and you had to put systems in place. We've come a long way, and maybe we're seeing a bit of a sunrise, and we can brief ourselves. And that's why I asked you earlier if you're taking a break, to just take stock and see that we've done a good job so far. But now there's another important critical phase ahead of us, and maybe you'll just share your thoughts on this taking stock, and also as it relates to what do we see going forward? A second spike, it's looking not very good in Europe right now. And what are your thoughts as it relates to your leadership team and plans in place for South Africa?
Yeah, I think what you're saying in terms of just like getting something that just feels like a break, and maybe shifting your focus, and then allowing you to go back and to see how far you've come and how much you've achieved is very, very important. So I think what we've done is we reintroduced normal business things. We revisited our strategy. We said, is this still relevant? Are we still on the right track? What did we learn that can enhance our strategy going forward? And then starting to do that normal work in terms of rebuilding everything that we had lost through COVID. The responsibility for your organization as well as the country as a whole actually gives you a new sense of purpose to say, now we've got a new leadership role to play. And then you also think about, you've learned so much, you don't have to repeat those lessons. So what have we learned? And stopping and reflecting on that and listening to people's stories about how it impacted them. If you think, talking about two healthcare workers, whether they were in leadership positions or at the front line of care, they feared for their own lives, they feared for their families' lives. There was an economic and financial impact that they've suffered. Mothers had to homeschool their children, whilst they were also continuing with their professional careers, people working from home. So it was actually like a big trauma, I think, for a lot of people. So actually stopping and pausing and debriefing on that trauma, reflecting on it, and then finding the benefit that you got from it in terms of the lessons learned, and then crafting a new path and say, I've got sense and I've got purpose, and I'm going to contribute to making the country and the world a better place post-COVID, then gives people that feeling of the sun coming up over the Mediterranean. And certainly I think in our teams we've seen it. People are very tired, but people have a sense of purpose and a sense of achievement, which is very important to reflect on.
Yeah, certainly seeing the sunrise over the Alps doesn't give you any more energy. You still feel tired, but it does give you some sense of joy. I see Chris van der Walt is joining us, a mutual friend, and he set up this interview. So thank you so much for joining us, Chris. And he's saying hi to Alex and Anchen. Great to see you both. Jordan has also joined us, saying such huge respect for the medical profession. What an exciting profession you have in emergency medical care, Anchen. Thank you for putting your life at risk to attend to those affected by COVID-19. So thanks for joining, Jordan. Now, as it relates to this pep talk, taking stock and it's, having a look at your plans and what is still applicable, what have you learned, what do you see going forward? Is the second wave something that we need to be worried about? I mean, what's the Europe situation? What's the forecast for us? We've always just been about 2 months behind what's happening elsewhere, despite the weather. We were behind in numbers anyway. So what do you think is happening in South Africa over the next number of months?
So I think we see what we've seen in the first surge as well, as we see different provinces responding differently. So we certainly in the Eastern Cape at the moment see the numbers increasing significantly, and the numbers increasing significantly, and our hospitals filling up again, where other provinces are not in the same position. So I think it's very important to have your principles in place, but to manage them differently as the situation unfolds in different provinces, so that you can normal business and normal services in the least affected provinces. I think if we have a repeat of what we've seen previously, we're certainly going to see a second surge, whether it's going to be similar to Europe or not. We certainly didn't see a first surge that was exactly similar to Europe. And there's various theories and interpretations about why we saw something differently. I think we did have the benefit of knowing, for example, certain drug therapies and ventilation therapies that we had the benefit of learning from our European colleagues that we could manage differently. So we saw we see a more contagious disease in Europe, but with a lower mortality and with less severity. And if we are going to see that as a second surge, then I think we will be okay as a country. I think we'll be okay. We're certainly going to see another impact. How long it's going to take, I think, is very much up in the air at the moment. So taking it day by day.
Okay, all right. We continue to live in that. It seems like life has just changed to a more, our horizons used to be, 18 to 30 months kind of thing, 1.5 to 5 years. Now our horizon seems to be the next 2 to 6 weeks or 3 months. We're kind of living in the shorter space. It's almost like we continue to live in a sprint. And if we set about to run a marathon at sprint pace, we're not going to make it. So what advice would you give to people? I mean, is there a sense of this the second surge part of just fatigue of just washing your hands all the time and just I don't know when this is going to end. I can't always live like this. I just drop my guard a little bit. Is how much of that spike is related to that kind of thing?
Yeah, I think definitely. I think people are fatigued from many things. They are fatigued from wearing masks, from not seeing their friends, from not being social. And unfortunately, that does spark that kind of behavior where you do relax a little bit on the stringent infection prevention and control measures. I think what people must maintain is hand hygiene, social distancing, mask wearing. And then also, the mental health management of these kind of things is also very important. So you do have to go out. Yeah, whatever it is that you need to do to be good for your mind, whether it is exercising, seeing your friends, or just getting back to some of the hobbies, I think is critically important, because the mind is fatigued as is the soul, and it is important to replenish that so that you are able to still maintain the same principles. I think that the regulations are certainly significantly relaxed, and we can do a lot of things that we couldn't do earlier in the year. So it's just maintaining that balance, and not having to go back to a hard lockdown, which I think would be devastating for people from a mindset perspective as well as from an economic perspective.
Yeah, I think the mindset would be crushing for a lot of folk. Particularly, I mean, in South Africa, we're quite privileged to have a lot of space, and not everyone has a lot of space, but certainly the country is wide and vast. But can you just imagine living in Singapore or Hong Kong on the 40th floor in a lockdown? That must be something else to contain or to keep your wits about you in a sort of 6 weeks of being stuck in a flat on so high up. The other sort of armchair theory that I've been chewing on the last few days, and it's great to be able to talk to someone who's an expert on this, is along the way, over the last hundreds of years, there's been some significant changes. And one thing that stands out for me is hand washing, hygiene, and then the sudden drastic reduction in mothers dying in childbirth. And that obviously makes sense because you don't want to be working on cadavers and then helping mothers deliver babies. Washing hands, that became the norm. Now you wash hands. Now we're living in a society where we sanitize our hands, 10 to 50 times a day. Is that going to do something besides the habit of change of that? Is all this sanitizing of your hands killing some natural oils and bacteria and life in the way we know it now, and that we wouldn't be able to recover from, such that our bodies and immune systems are now going to be permanently compromised, and we wouldn't be able to backpedal out to no more alcohol 50 times a day on your hands?
Yeah, I think there's certainly. I can think back of being in the shopping mall recently and thinking I'm actually contemplating whether I'm going to go into a shop. I'm not just willy-nilly strolling in, because every time I go in, I have to get my temperature checked and my hands sanitized. So there's certainly that impact on it. I think there's a lot of secondary benefits around it. I think if you looked at the respiratory viral statistics just in South Africa, there was a lot less of general influenza and all sorts of viral diseases that all of us would have had, the seasonal flu, because children didn't go to school and people just washed their hands and maintained social distancing. And so in a sense, the reduction of trauma-related deaths we saw in our country and the reduction of other viral illnesses was certainly a secondary benefit from COVID. And in that sense, we live in the era of where we are faced with antibiotic resistance because of the misuse of antibiotics, which gives rise to all sorts of other infections or situations in hospitals. And I think that the front of mindedness around infection prevention and control benefited immensely from COVID. And it's something that I hope remains in place, because there will certainly be secondary health benefits that we will see for a long time to come because of COVID. So I'm thinking on the positive side around this, that we are going to see a reduction in hospital-associated infections because of people's better awareness of how viruses and bacteria spread.
I was about to say thank you for your positive spin on this, and it's great because I didn't think about that at all. So I really do appreciate that you gave it a positive spin. So in general, has the general cold and flu virus been significantly lower this year than in other years?
Yeah, it was significantly lower, specifically because we saw the biggest impact of the COVID surge during the winter months, where we are always very much affected by all of the types of viral illnesses, respiratory viral illnesses. So that significantly dropped, and then it was balanced out by a significant increase in COVID-19. So there was still a significant volume of respiratory illnesses, but the normal things we definitely see fewer of. When children started going back to school and people started going back to work, you saw an increase again in the respiratory viruses of other nature than COVID-19.
Okay, all right. So I'll keep sanitizing my hands and wondering. But the other thing that I'm very curious about is this the 2 year, 5 year down the line, the perspective and looking back, because in our lifetime we haven't seen something like this that has affected the whole world and just been so hard to understand. Why is it that some people die, some don't? Why is it some people have no symptoms, such a high volume of people don't have symptoms, etc. But to do the study in about 3 or 4 or 5 years time, looking back on what happened now, is going to be fascinating to read about what it was. But I also want to ask you, so in your position as the sort of head of medicine in a significant hospital chain in South Africa, company, do you meet with other equivalent partners across? Is there a think tank that gets together weekly, monthly? The Department of Health equivalent and the Mediclinic, etc., and all the other hospital groups. Do you have this new working relationship that perhaps wasn't there before?
Yeah, definitely. So we as an industry, we really got together very, very regularly. So with a professional association, doctor groupings, with our counterparts in the other private institutions and also publicly. And there's still forums continuing on a less frequent but still regular basis, where we say we've worked well together. We had a common enemy in COVID. We were united against this common enemy. And there are other similar common enemies that we could benefit from sharing learnings from each other. So it was certainly a great forward moving in terms of better collaboration across the private and the public sector industries, and even between different industries, not really just medicine. So we will continue that. I think that the system as a whole can benefit from learnings pooled together, instead of each one having to learn their own lesson, and the cost related to that.
Well, that's great, and it's nice to have another positive spin on it too. So, Anchen, it's been wonderful chatting with you. I like your positive energy and the thoroughness and the preparation that you shared with us as well, and the detail. It's really fascinating to get the behind the scenes story as well from someone who's leading these teams. What you've gone through it now. You've done your bit of assessment of looking back, and now you're looking forward to the next challenge and how you're going to continue with your business as usual work. But to other people who may be in a similar position where you have to create something high performing, a team that has to face something new, maybe not on the scale of COVID-19, but what are your tips in creating a high performance team?
I think it is often in these high performance teams, you deal with a lot of type A personalities and people who are very decisive and ambitious. And I think it's unlocking the benefit from that instead of seeing it as a deterrent. You could be at loggerheads with people who are opinionated and driven, but it's like reversing the situation and say there's greatness in everyone. And how am I going to try to unlock everyone's greatness so that the accumulated benefits can be much more than the sum of their individual parts? And I think that's important. You can do that. You can get on with everyone. If you find resonance, and there's always resonance between people, and that can lead to a great team where members feel appreciated, they feel that they make a unique contribution, and it actually inspires them to be greater versions of themselves. And I think the second big thing for me is that no education or no learning is ever wasted. So whenever you have an opportunity and you stop and you think, I actually don't know why I have to go through this. This is really hard. You think that somewhere down the line you're going to think, I don't know where I've learned this, but I'm glad I banked that lesson because it's benefiting me somewhere down the line. So I think those are two very important things, and and then always be always recognizing context and recognizing complexity and considering all of the variables in the equation, and not going down. Being one-track minded is important. So it's all about versatility. It's about appreciation of other people. It's about everybody together being better than yourself on your own. And in that, you actually find that camaraderie is very important. And that's one of my fondest memories of my EMS days. And I said to you earlier this morning that I'll go back in an instant. Helicopter flying will always be the glitter in my eye. And I think camaraderie plays a very important role.
Oh, that's wonderful. And I like the way you summarized it. Thank you for your tips. Thank you for your time. And so last question for you. So I'm going to give you an opportunity for the rest of your career to be a flying doctor or the Minister of Health. What are you going to choose?
I really will have to sleep on that. Maybe I'll be able to be the Minister of Health and I can do some part-time shifts on the helicopter over the weekends.
That's a great idea. Another positive spin. Anchen, thank you so much for your time. I really appreciate it. And we've got some great feedback already along the way. So comments, and all the best for this preparation for the next surge that's coming. And really, thank you. Thank you for you and your teams. You've done a great job looking after our country. And thank you for your time today.
Thank you, Alex. It was lovely chatting to you. And thank you for everyone who listened. And good luck for all of us. And have a wonderful day further.
Thanks. Well, folks, that was a fascinating conversation. Really enjoyed that. I hope you got the benefit out of that too. Thanks for joining me. And until next time, please stay tuned.